Hi, I'm Nicole Ferguson.
And I'm Kelly Mooney.
We're dietitians at Health Alliance Hospital for the Diabetes and Nutrition Center. We're here today to talk about popular fad diets, one in particular called the low-carb diet. We're here to answer many of the popular questions we've been asked along the way.
So Nicole, what is a low carbohydrate diet?
Well, typically low-carb diets restrict the amount of carbohydrates you get in throughout the day. But depending on the diet, they can be anywhere between 50 to 150 grams of carbohydrates. Our carbohydrates are typically your fruit, some of your vegetables, your legumes, and your grains.
And what can they promise you?
Well, most promise weight loss, but some promise that they'll reduce your risk for developing diseases like cardiovascular disease, type 2 diabetes, and even certain cancers.
So Nicole, why do we need carbs?
Kelly, they're so important to us. They play a vital role in our energy levels. We store them in our muscles to use for energy, especially when we exercise. We store them in our brain to help us think throughout the day, and we even store some in our liver for later usage.
So can you really lose weight on a low carbohydrate diet?
Sure, but technically you can lose weight on any diet that restricts calories in what you eat. And we're not even sure if it's the carbohydrates that help us to lose weight anyway. Typically on a low-carb diet, people are snacking less and they're eating more protein and fat, which helps us to stay fuller throughout the rest of the day.
But what about reducing the risk for heart disease and type 2 diabetes?
Well, typically what we see with any weight loss is that you reduce your risk for heart disease and type 2 diabetes. You'll see improvement in your LDL levels as well as your HDL levels.
Are there any side effects?
Well, you have to be cautious of any fad diet with side effects. Some you'll see on a low-carb diet could be constipation, fatigue, mental fatigue, and in some severe cases, hospitalization. If you're looking to change your diet or lifestyle, ask your physician for a referral to the Diabetes and Nutrition Center at Health Alliance Hospital. If you have any questions, contact us at 978-466-4580.